I was very confident, and all confidence, all knowledge, all because of conceptual orthopedics.
Afternoon, कैसे हो?
Sir, how are you, sir?
I'm fantastic.
Sir, since UG times, I am a great admirer of you and Dr. Tuli, sir.
Oh my God. डॉक्टर तुली
Sir,
को कैसे जानते हो तुम?
this book,
यूजी
sir.
टाइम
Sir, I have this book from my UG time, and this page, it was very inspiring, sir.
thanks to the designer who created it beautifully. So Yash,
It was
you have grown as an orthopedic surgeon now. That is
yes, sir.
phenomenal. That's beautiful. And I hope that one fine day your name also shines like Professor S.M. Tuli's name in the country and the world
Sir,
beyond. That's what I can pray as a teacher, as a student of science. So Yash, let's talk about number one, your journey as an orthopedic surgeon. So first of all, heartiest congratulations to you and your parents. First
thank you,
of
sir.
all, they have a doctor in the house. Number two, the doctor is an orthopedic surgeon, right? And number three, you've been trained at the times when the world was stuck with COVID.
Yes, sir.
So you have, I'm sure, personally, professionally gone through a lot of hardships. And
Yes, sir.
this degree is a very, very valuable one. And congratulations to you, Yash.
Thank you, sir.
How are you
Sir,
feeling getting MS Orthopedics behind your name?
I have just completed my final viva yesterday. I was very confident, and all confidence, all knowledge, all because of conceptual orthopedics. The things that were taught in the conceptual orthopedic, the knowledge is coming from most senior most faculties of the India. So we get that confidence that we are right. Whatever we are listening, it is 100% right, and we can tell this without any doubt. And no one can tell that it is not true. It is confidence, sir. Confidence that was because of conceptual orthopedics.
Yash, when you look at yourself going through an exam,
Yes, sir.
any viva, right?
Yes, sir.
As a student, you have gone through the books. As a student, you have gone through the teachers' lectures.
Yes, sir.
Howsoever good is the book, howsoever good is the teacher. But then, most important is that the student has to be acceptable to learning to answer there.
Yes, sir.
So I think the biggest credit goes to you and your family for providing that support and you acquiring the learning. And
Thank
it
you,
is
sir.
good that the books and the teachers and this learning platform, Conceptual Orthopedics, could be there with you.
Sir,
But never ever underestimate the contribution of your family and your own contribution in life. I say be humbly acceptable that yes, you have worked hard. ऐसे कोई टॉप नहीं करता, ऐसे कोई अच्छे मार्क्स नहीं लाता, ऐसे कोई पास नहीं होता. That's
sir,
very true.
sir, when I was in first year, orthopedic में admission ले लिया. I was very happy, and I wanted to learn everything. I purchased many books, sir. I have many books, but वो सब एक साथ आ गया ना, तो मैं डर गया अभी कितना पढ़ूंगा इधर से. But at end of first year, मैंने आपका एक Facebook पोस्ट देखा, conceptual orthopedics, और उसमें था कि देयर इज सम मल्टीपल डिस्काउंट. मैंने सोचा जल्दी जल्दी मैं बुक करता हूँ, मैं रह जाऊंगा. मैं रिफ्रेश करता बैठा था प्ले स्टोर पे, जैसे ही आता है मैं डाउनलोड करूंगा. मैं वेट कर रहा था सर कि कुछ ऐसा सोर्स हो जहां से मैं लर्न कर सकूं, और कॉन्सेप्चुअल ऑर्थोपेडिक्स आ गया. वो दिन से अब तक मैं कॉन्सेप्चुअल फॉलो कर रहा हूँ सर.
यश, तुम्हें एक बात बताता हूँ, यू वोंट बिलीव इट्स ट्रू. तुमने प्रोफेसर एस एम तुली का नाम लिया ना.
यस सर.
ही इज इंडियन ऑर्थोपेडिक एसोसिएशन लाइफ मेंबर नंबर 1.
यस सर.
He is the first member of Indian Orthopedic Association. one fine day, right, when conceptual orthopedics becomes something of meaning to the world, you are the first subscriber of conceptual orthopedics.
Yes, sir.
You are our first subscriber. So there's a similarity between you and Sir. When IOS was being formed, Sir was
Sir,
given the first membership, and when CO was being formed, you were the first one to trust it, right? And let's talk about your journey in conceptual orthopedics. I will take it in a different way.
yes,
I
sir.
will divide conceptual orthopedics into 5 pillars.
Yes, sir.
One pillar is the books of conceptual orthopedics.
Yes, sir.
Your experience with the books, Yash.
Sir, I have completely read the trauma book and the examination book. The recent one I got very late during my exam time, तो थोड़ा पढ़ा है, but it is very good and helpful. उसमें से मैंने रिसेंट एडवांसेस के कुछ टॉपिक पढ़े हैं. इट इज़ वेरी हेल्पफुल. लास्ट टाइम मोमेंट पे भी मिला, बट उसमें से जो मैंने कुछ थियरी पढ़े तो मेरा कॉन्फिडेंस बूस्ट हो गया. एंड ट्रॉमा बुक इज वेरी गुड सर.
Fantastic. I will pass on the message to the team who has worked day in, day out on the book. Right?
ट्रॉमा बुक इज वेरी गुड सर.
Fantastic. Yash, second pillar is the MCQ division. We have had the sessions also. We have made the
यस
book
सर.
also. During your preparation, were you able to have a look at these MCQs and MCQ book? You have not gone through the MCQ book
नो
and the
सर, आई
MCQ.
हैव नॉट अटेंडेड मेनी सेशन ऑफ एमसीक्यू. Some sessions of MCQ I have attended.
All right. So I hope that when you write any super specialty or FNB exam,
Yes
these
sir.
are the sessions which will be very, very useful for you.
Yes sir. I'm going to use it afterwards sir.
Fantastic. The third pillar is the notes in the app.
Yes, sir. The notes I was reading in casualty before OT or during OPD also. It is better to search something from validated source than on Google or somewhere else.
So you were able
और
to find it there.
yes, sir. And उसमें एकदम concise दिया है and all relevant information is included in some pattern. So you can remember that.
Right. The fourth pillar is the live sessions, including OSCE, where
Yes,
you have daily live sessions where you can interact with the teachers.
yes, sir. I tried to attend as many sessions as possible, but in residency, many were missed. But live sessions are very helpful, sir. Question answer session after that, it is very helpful.
And the last is the recorded lectures.
Recorded lectures, I have tried to cover as many as possible, sir. All are very helpful. All recorded sessions, sir. Uh, One topic from different faculties. Every time we get to know something different. It it is written in the book, but the wisdom comes from the senior faculties. It is very helpful, sir. Some rare clinical findings, what to ask to the patient for getting some details, what specific things to look on X-ray. We generally miss them. Everything is very helpful, sir.
Right.
In clinical, in OT, before OT, आगे के दिन पे जो भी केस रहता था, in night I was seeing that video only, sir. All trauma.
Fantastic. As you say, the learning never ends, Yash. What we have started now is in conceptual orthopedics, we have started with offline courses.
Yes, sir.
We have a trauma course on 23rd or 24th July in Bangalore. We have a sports injury course on 3rd or 4th in September in Delhi. 11, 12, 13 November 2022, we have the postgraduate course.
Yes, sir.
As a premium subscriber, you are absolutely welcome to attend each of them.
Sir, I will be happy to attend, sir.
Yeah, that's your right. It's your right. And you have to understand your learning never ends. It doesn't end with a degree.
Yes, sir.
Degree gives you the right to practice, but what to do in the practice can only be acquired if you keep learning every day. Be
Yes, sir.
acceptable to new ideas, new methods, but never forget that the best is the clinical examination.
Yes, sir.
Let's talk about a few of the teachers that of conceptual orthopedics. And let's do a rapid fire. If you just have to put in there a word to describe them, what will be the word you describe them? And you can't repeat the same word in front of the same teacher again, the next teacher. So you have to think of new words. So we'll start with the most senior, Professor SM Tuli sir.
Sir, he is godlike.
So you have used the word God, and you will be short of more synonyms. So Professor Sudhir Kumar sir.
Sir, my vocabulary is not that good, but I am very thankful for his all examination videos, sir.
Fantastic. Professor Anil Dhal sir.
Details describing ex- all examination videos is very helpful, sir.
Fantastic.
I
Professor
have
Bhasin.
revised those videos as many as time possible, sir.
Right. So there's a takeaway message. Revise the clinical examination videos again and again.
Yes, sir.
Professor Bhasin sir.
Basim, sir. Today I saw his one video, Career in Orthopedics. 10 minutes video is there in app. It is very inspiring. उसमें सर बोल रहे हैं at the end of his residency, तुली सर ने उनको बुलाया और बोला कि next 3 years of your life, whatever you are doing, you will be doing for your rest of your life. So I found it very.
So you are there right now, Yash. You are there at the end of your residency, and next 3 years will define what you do now.
Yes, sir. It was something
Eye-opening.
eye-opening, sir.
Professor Shantaram Shetty, sir.
Ram Shetty, sir. I have in many videos, sir. Sir, I am very weak in vocabulary, sir.
I will tell you, he's the cucumber is as cool as him. That's what I say. He's not cool as a cucumber. The cucumber is as cool as him. So he's relaxed on that aspect. And I think you've been watching a lot of trauma videos, Yash.
Yes, sir. I was watching many trauma videos by
What about your trauma teacher, Dr. Shailesh Pai, sir?
Dr. Shailesh Pai, sir. Sir,
Any message for him from your side?
sir, I am a student and I cannot talk about my teacher, sir, but I am very thankful to all. And
Understand the emotions, but there are ways of thanking. One is joy, one is a hug, one is a gratitude, and there are many ways to do that, and you can enjoy it, right?
yes,
And
sir.
I am sure that as you go down in next 2-3 years, you will need a lot of trauma videos to understand the concepts.
Sir,
And
that's
make a
why
note
I'm
to watch
continuing
his.
my conceptual orthopedics.
I know that. I know that you're going to be there with us till 2027. That's going to be
9, sir.
29.
Yes, sir.
That's going to be phenomenal, yes. So it's a relationship that's almost going to last a decade or more. Let me
Yes,
help
sir.
you on that. Yeah. So Yash, apart from these dimensions, right?
Yes,
The
sir.
recorded lectures, the live lectures, the books, right?
Yes, sir.
The OSCE sessions. There is one teacher who will build up the tempo during the live session, Dr. Timmery.
Yes, sir. Dr. Ravinder Dimri, sir, I have attended many lectures of him, and the way he teaches, asking many questions, and then someone answer that, and then he corrects him.
That's good.
It is very helpful, sir.
Good, Yash. What about the shoulder specialist, Dr. Harpreet?
Harpreet, sir, the examination video and the scopy video and some theoretical topics, sir. It is very helpful, sir.
Just want to
I
tell
have
you, Dr. Harpreet has also one number along with him. He was rank 1 in Delhi.
oh, sir, nice, sir.
There are a lot of ones here. Professor Lee, the first IOA live membership. Yash, the first subscriber. Dr. Harpreet, rank 1. Then I'll talk to you about the youngest teacher of conceptual orthopedics, Dr. Fahim.
Sir, his presentations are very good, and remembering the retention of things are very good after seeing his lecture because of his way of presentation.
Right. And there are some names. I will not take this discussion long, but there are some names through which I will take this chance to thank them. I will like to thank Professor Graichen's arthroplasty videos, Dr.
Yes, sir.
Ajit Sir's continuous contribution to conceptual orthopedics, Dr. Ashish Taneja sir for contributing here. Most importantly, you know, there's a pillar behind Dr. Nauful Nahas, who
Yes,
has
sir.
been day in, day out working on the notes, the books, coordinating the live sessions, organizing the live sessions, right? We are very thankful to him. And if you go down to the south of India, you have a Kohinoor there, Professor Gopa Kumar.
Kumar, sir.
The way he takes a presentation and the way he conducts it and the way he engages you is something very, very phenomenal.
Yes, sir. The lecture of Gopa Kumar sir is complete. We don't need to read from anywhere after seeing his lecture.
Fantastic. And now we have also started our spine series with Dr. Jitesh.
Yes, sir.
Every week, because spine is such an important area. So we thought that we must have cold orthopedics, we must have spine, and we must have trauma. And then one teacher, although bone tumors are not very common, but then oncology is an upcoming branch.
Oncology.
He is a phenomenal teacher,
Sir,
Dr.
Dr.
Sageet Verma.
Yes, sir.
And he again, I think, is in the category of Dr. Fahim. His presentations are beautiful.
Yes, sir. Well updated.
One word, just one word aloud, by which you will describe Conceptual Orthopedics app. You are in an interview. You have just cleared a viva. You have topped it. You should be able to answer this.
Sir, I am just very thankful to Conceptual Orthopedics and the all knowledge and confidence.
All right.
I am very thankful to.
Fantastic.
Sir,
Now we talk
sir,
about Yash now. Yeah, you want to say something, please.
sir. I was very first in this area for conceptual orthopedics. मैं लेक्चर देखता था, मैं सुबह जाके मेरे जूनियर्स को, मेरे कलीग को सिखाता था एवरी डे, क्योंकि ये लेक्चर देखने के बाद मुझे कंप्लीटनेस फील होती थी कि आई नो समथिंग इन डिटेल, और उसके अलग अलग एस्पेक्ट मुझे पता है. तो उसकी वजह से आई वॉज टीचिंग माई जूनियर्स, माई कलीग्स, और वो देख के ऑल माई कलीग्स ज्वाइन द कॉन्सेप्चुअल ऑर्थोपेडिक्स.
Right. Right, Yash. So you were the first to join. By your teaching, you inspired people to join. But now finally you are an orthopedic resident who has completed, has got a degree now. Which is an area which has started interesting you as a branch, a sub branch of ortho?
Sir, I was very fond of orthopedics since my UG times.
But in ortho, sports, arthroplasty, trauma, spine, pediatrics.
As per now, sir, I am slightly inclined towards trauma, but I want to explore some possibilities.
Do that, but I can promise you, if you become a good trauma surgeon, you'll have a fantastic, splendid career.
Thank you, sir.
And Yash, we have created something called as an OPD series, which was the brainchild of Dr. Raju Easwaran.
Yes, sir, I have seen that.
Now to go into the residency and diagnose a patient and treat it.
Yes, sir.
So this is beyond the aim of CO is just not to help you pass the exam. The aim is to improve you as a clinician.
Yes, sir.
And the bigger aim is that you are able to excel, right, into the counseling of the patient.
Yes, sir.
Take a decision, which is the one which requires an operative care, which is the one which does not.
Yes, sir.
And then if it doesn't require an operative care, you should be able to justify your treatment. If it does, then you should be able to perform better.
Yes, sir.
The learning is a continuous process. Young man, I'm sure the way you are very humble, You're a very humble
Yes.
person. Do you know that? Very humble person. And people like you are the ones who go the longest in life. They rise
Thank
highest.
you. Thank you, sir.
My wishes is you have a splendid brain. I don't doubt that. You are focused towards orthopedics. I don't doubt that. But out of the three things, your brain, your focus, and your attitude, it is the correct attitude which will take you the best and the longest. Be ready to learn, imbibe like a sponge, and as they classically say, rise and shine.
Thank you, sir.
And have a bigger role in conceptual orthopedics. Become active in live lectures, keep
Yes,
attending
sir.
them, keep being an active participant, and
Yes,
see
sir.
you in one of the offline courses, either in Bangalore or Delhi.
Yes, sir. Sure, sir.
Pay my regards to your family and
Yes.
congratulations to everybody.
Thank you, sir.
Bye, Yash. Have a good day.